Signs before a stroke. Today we're diving into a critical health topic, one that could help save lives. Strokes are among the leading causes of disability and death worldwide, yet many people don't recognize the warning signs until it's too late. By understanding the early symptoms of a stroke, you can take action before it becomes life-threatening. In this video, we'll discuss what happens before a stroke, the symptoms you should never ignore, and what you can do to help yourself or a loved one in an emergency. What is a stroke? A stroke occurs when the blood supply to a part of the brain is suddenly disrupted, preventing brain cells from getting the oxygen and nutrients they need. If not treated immediately, brain cells begin to die, leading to serious complications, disability, or even death. There are two main types of strokes. 1. Ischemic stroke. This is the most common type, and occurs when a blood clot blocks a vessel supplying blood to the brain. These clots can form due to fatty deposits in the arteries, known as plaque, or as a result of other cardiovascular issues. 2. Hemorrhagic stroke. This occurs when a weakened blood vessel bursts, causing bleeding in the brain. It is often linked to high blood pressure or aneurysms. A transient ischemic attack, TIA, also known as a mini-stroke, is a temporary blockage of blood flow to the brain that resolves on its own. While TIAs do not cause permanent damage, they serve as serious warning signs of a future stroke and should never be ignored. Early warning signs of a stroke. Strokes often do not come without warning. There may be symptoms, hours, days, or even weeks before a full-blown stroke occurs. These symptoms may come and go, or seem mild at first, but they should never be ignored. Sudden weakness or numbness. One of the most common stroke symptoms is sudden weakness or numbness in the face, arm, or leg, especially on one side of the body. This could manifest as a loss of grip strength, difficulty holding objects, or an inability to move a limb properly. Some people describe it as a feeling of their limb falling asleep, but unlike normal numbness, this sensation does not go away after a few minutes. In some cases, the weakness may start mildly and worsen over time. The person may suddenly struggle to perform everyday tasks, such as buttoning a shirt, writing, or holding a cup. If the numbness affects the face, it may appear as a drooping mouth, difficulty smiling, or asymmetry when trying to move facial muscles. This happens because the stroke is blocking blood flow to the brain, affecting motor control. If you experience or notice someone showing sudden weakness or numbness, seek medical attention immediately, as this is one of the clearest warning signs of a stroke. Speech problems and confusion. A stroke can affect the brain's ability to control language, leading to slurred speech, difficulty speaking, or trouble understanding what others are saying. This can occur suddenly and without warning. Some people may find themselves unable to form coherent sentences or notice that their words are coming out garbled. Others might have trouble understanding simple questions or following a conversation, even if they feel mentally alert. One of the best ways to test for stroke-related speech problems is to ask the person to repeat a simple sentence like, "The sky is blue." If their speech is slurred, jumbled, or incomprehensible, it is a major red flag. What makes this symptom especially dangerous is that many stroke victims are unaware that their speech is impaired. They may think they are speaking normally, even though others clearly notice the difference. This is why it's important for friends, family, or bystanders to recognize the symptoms and take action immediately. Vision problems. A stroke can cause sudden and severe changes in vision, including blurry vision, double vision, diplopia, loss of vision in one or both eyes, seeing flashing lights or dark spots. Some stroke survivors recall experiencing what they described as a curtain or shadow covering their vision, while others temporarily lost sight in one eye. These visual disturbances occur because the stroke is affecting the part of the brain responsible for processing vision. In some cases, the person may not even realize their vision is impaired, especially if only one eye is affected. They might continue normal activities until they notice difficulties with depth perception, reading, or recognizing faces. If vision loss occurs suddenly and without explanation, it should be treated as a medical emergency. Even if the problem seems to resolve on its own, it could be a warning sign of a transient ischemic attack, TIA, also known as a mini-stroke, which greatly increases the risk of a full stroke in the near future. Dizziness and loss of coordination. If you experience sudden dizziness, trouble walking, or a loss of coordination, it could be due to a stroke affecting the cerebellum, the part of the brain responsible for balance and movement. This symptom is often mistaken for vertigo, dehydration, or low blood sugar, but when combined with other signs of a stroke, it is a major cause for concern. Some people may feel as if the room is spinning, a sensation known as vertigo, while others may suddenly stagger or fall without any obvious cause. Other warning signs include feeling unsteady while standing or walking, struggling to pick up small objects, difficulty maintaining posture or balance, uncontrollable eye movements, nystagmus. If dizziness occurs alongside numbness, slurred speech, or confusion, do not ignore it. Seek emergency medical help immediately. Severe headache. A stroke-related headache is often described as sudden, intense, and unlike any headache you've had before. Unlike migraines, a stroke headache can be accompanied by vomiting, confusion, or trouble concentrating, loss of consciousness, severe neck stiffness in cases of hemorrhagic stroke. This is especially common in hemorrhagic strokes, which occur when a blood vessel bursts in the brain, leading to bleeding and increased pressure inside the skull. Some people report the pain as the worst headache of their life, often described as a thunderclap headache due to its sudden and explosive nature. If you experience a sudden and severe headache, especially if it is accompanied by other neurological symptoms, seek immediate medical attention. Do not assume it is just a migraine or stress-related pain. It could be a life-threatening stroke. FAST. The quickest way to recognize a stroke. One of the simplest ways to recognize a stroke is by using the FAST acronym. F. Face drooping. Ask the person to smile. If one side of their face droops or looks uneven, it could be a stroke. A. Arm weakness. Ask them to raise both arms. If one drifts downward or they can't lift it at all, that's a warning sign. S. Speech. Difficulty. Ask them to repeat a simple sentence. Slurred or jumbled speech is a major red flag. T. Time to call emergency services. If you notice any of these symptoms, call for help immediately. Every second counts. What to do. If you suspect a stroke, if you suspect that someone is having a stroke, do not wait to see if the symptoms go away. Immediate medical attention can save their life and prevent long-term complications. Here's what you should do. 1. Call emergency services right away. Don't attempt to drive the person to the hospital yourself unless absolutely necessary. Paramedics can begin treatment immediately. 2. Note the time of the first symptoms. This information is crucial because some stroke treatments are only effective within a specific time window. 3. Keep the person calm and comfortable. Lay them down with their heads slightly elevated and reassure them that help is on the way. 4. Do not give them food, water, or medication. Swallowing may be impaired, and certain medications can make things worse. Reducing the risk of stroke. While some risk factors like age and genetics cannot be changed, many lifestyle factors can significantly lower your chances of having a stroke. Here's how you can reduce your risk. Control blood pressure. High blood pressure is the leading cause of strokes. Monitor your levels regularly and take prescribed medications if necessary. Maintain a healthy diet. Eating foods rich in fruits, vegetables, whole grains, and lean proteins can lower stroke risk. Reduce salt and processed food intake. Exercise regularly. Staying active helps control blood pressure, weight, and cholesterol levels. Even 30 minutes of moderate exercise a day can make a difference. Quit smoking and limit alcohol. Smoking damages blood vessels and increases clot formation, while excessive alcohol consumption can raise blood pressure. Manage diabetes and heart conditions. People with diabetes or heart disease are at a higher risk of stroke. Regular checkups and proper management can help prevent complications. Recognizing stroke symptoms early can save your life or the life of someone you love. The key takeaway is never to ignore sudden changes in speech, movement, vision, or balance. If you notice any of these warning signs, act fast because every second counts. If you found this video helpful, don't forget to like, share, and subscribe to help spread this vital information. Let's raise awareness together and keep our community safe. Stay informed, stay healthy, and we'll see you in the next video.